Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. In last two videos, we have already discussed about the concept of emergency nursing and concept of triage. In this video, we will continue the topic triage with its types and color codes. Let's start today's session. Today in this video, we will cover the types of triage, international 5-tier emergency triage system and triage system based on National Health Mission. Next, we are coming to types of triage. First is disaster triage and another one is emergency triage. What is disaster triage? This triage system or categorization is used in case of mass casualty. That means at the time of disaster that may be natural or man-made. The second one is emergency triage. Every day in hospital emergency department there were several footfalls at a time. So categorization is also needed in emergency department to take care of the patients as per their need. That's why for giving everyday service, the emergency department has a different triage system. First, we will discuss about the disaster triage. The most common disaster triage or mass casualty triage system is the STAR triage system. That is the simple triage and rapid treatment. Various criteria are taken into consideration to do this categorization. That criteria include the patient's pulse, respiratory rate, capillary refill time, the patient's ability to follow commands, and patient's ability to walk. In STAR triage, we can see there are 4 categories. First is minor. Minor is denoted by green color. Here the victims with relatively minor injuries, status unlikely to deteriorate over days or may be able to assist in their own care and also known as a walking wounded. These patients comes under this minor injury. Next is delayed. This is denoted by yellow color. The victim's transport can be delayed includes serious and potentially life-threatening injuries, but the status not expected to deteriorate significantly over several hours. Next is immediate, that is denoted by red color. Here the victims can be helped by immediate intervention and transport, requires medical attention within minutes for survival and includes compromise to patient's airway, breathing and circulation. And the last one is expectant, which is denoted by the black color. Here the victims are unlikely to survive given severity of injuries, level of available care or both. And palliative care and pain relief should be provided to these patients. Next, we will discuss about the emergency triage. There are internationally accepted 5-tier emergency triage systems. Those triage systems are Canadian Triage and Acuity Scale, Australasian Triage System, Manchester Triage System and Emergency Severity Index. Among these 4 scales, the Canadian Triage and Acuity Scale is the most common one. So, we will discuss this in details. And the Australasian Triage System, Manchester Triage System and Emergency Severity Index, we will give an overview of these 3 scales. Canadian Triage and Acuity Scale. In Canadian Triage and Acuity Scale, there are 5 levels. First is resuscitation, then emergent, then urgent, then less urgent, and the last one is non-urgent. Level 1 resuscitation. Color code is blue, response time immediate. Conditions that are threats to life or limb requiring immediate aggressive interventions. Examples of patients with cardiac arrest and respiratory arrest, major trauma, shock states, unconscious patients, severe respiratory distress. Conditions that are potentially threat to life, limb function, requiring rapid medical intervention or delegated acts. Examples are altered mental states, head injury, severe trauma, neonates, myocardial infarction, drug overdose, cerebrovascular accident. Any patients with compromised airway, breathing and circulation, Glasgow Coma Scale less than 8, evidence of obstructed or threatened airway, respiratory rate less than 10 or more than 30 breaths per minute, pulse rate less than 60 or more than 120 beats per minute, systolic blood pressure less than 90 or more than 180 mm of Hg. Level 2 is emergent. Color code is red. Response time within 15 minutes. Conditions that could potentially progress to a serious problem requiring emergency intervention may be associated with significant discomfort or affecting ability to function at work or activities of daily living. Examples are moderate trauma, asthma, gastrointestinal bleeding, vaginal bleeding and pregnancy, acute psychosis and or suicidal thoughts and acute pain. All patients with airway, breathing, circulation relatively stable but have potential to develop life-threatening problems. And all non-ambulatory patients with stable vitals. Level 3 is urgent. Color code is yellow. Response time within 30 minutes. Conditions that are related to patient age, distress or potential for deterioration or complication would benefit from intervention or reassurance within 1 to 2 hours. Examples are headache, corneal foreign body, chronic back pain. Conditions that may be acute but non-urgent, as well as conditions which may be part of a chronic problem with or without evidence of deterioration, like sore throat, upper respiratory tract infection, mid-abdominal pain which is chronic or recurring, vomiting, diarrhea. The investigations and interventions for some of these illness or injuries could be delayed or even referred to other areas of the hospital or healthcare system. Airway, breathing, circulation, vitals are stable. No clinical history suggestive of life-threatening or serious medical problem. Level 4 is less urgent. Color code is green. Response time within 1 hour. Conditions that are not related to patient age, distress or potential for deterioration or complications. Example, regular follow-up patient, those who discharged, prior outpatient slot booking patients, chronic diseases and daycare surgery, procedure, chemotherapy or cardiac angiography like this. Level 5 is non-urgent. Color code is white. Response time within 2 hours. Conditions that are not related to patient age, distress or potential for deterioration or complications. Patient are always ambulatory with stable vitals, plan admission for surgery or any other procedures. All periodic health checkup, employment health checkup, vaccinations and investigations. In Canadian Triage and Acuity Scale, all waiting patients should be reassessed within the following time frame. For level 1, continuous reassessment. For level 2, reassessment within 15 minutes. For level 3, within 30 minutes. For level 4, within 1 hour. And for level 5, within 2 hours. Next is Australasian Triage Scale. In Australasian Triage Scale, the category 1, the color code is red, the response is immediate, and life-threatening conditions comes under this category. Category 2, color code is orange, response time within 10 minutes. The imminently life-threatening conditions, important time-critical treatment and very severe pain comes under this category. In category 3, The color code is green, response time within 30 minutes, potentially life-threatening. The patient's condition may progress to life or limb-threatening or may lead to significant morbidity or situational urgency. These things comes under category 3. In category 4, the color code is blue or sky within 60 minutes response time and potentially serious. The patient's condition may deteriorate or adverse outcome may result. These conditions come under category 4. And the category 5 color code is white. Response time within 120 minutes. Less urgent, the patient's condition is chronic or minor, comes under this category. Next, coming to the Manchester Triage System. In Manchester Triage System, the first category is immediate, color code is red, and the response time is immediately. Next is very urgent, color code is orange, response time up to 10 minutes. Then urgent, color code is yellow, response time up to 60 minutes. Then standard, color code is green, response time up to 120 minutes. And the last one is non-urgent, color code is blue and the response time up to 240 minutes. Next is 5-level emergency severity index. Emergency severity index is also divided into 5 categories or 5 levels depending on the stability of vital functions, life threat or organ threat. Here also the response time or the how soon the patient should be seen by the physician is depends on the levels. Expected resource intensity also depends on the condition of the patient or in which category patient is lying. Next, the examples. The patient with cardiac arrest, trauma patient, overdose patient, bradypnea, severe respiratory distress, these patients comes under ESI category 1. Next, the chest pain, multiple trauma, unless responsive, altered mental status, this patients comes under ESI category 2. Patients with abdominal pain or gynecological disorder, unless in severe distress, hip fracture in older patients comes under the ESI category 3. And the patients with extremity trauma, simple laceration or cystitis comes under ESI category 4. And the patients with cold symptoms, minor burn, prescription refill, this kind of patients are coming under the ESI category 5. Next, coming to the triage system based on National Health Mission. Depending on the 5-tier emergency triage system, National Health Mission prepared this triage system which is easy to understand and easy to perform in Indian scenario. There are 3 color codes, red, yellow and green. And these color codes depends on the 4 parameters, that is airway, breathing, circulation and disability. So this is about today's session. The last part of this topic will coming soon. If this video is useful for you, then it is requested to put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.